Hello friends, today we are going to see a clinical question, okay, clinical bites. So this is a interesting question, so I thought to discuss with you guys. So let's first read the question. In your ward, you administer intravenous thiopentone sodium to your patient. As soon as you inject the drug, patient complains of severe pain in his fingers. Fingers become sinus. How will you manage? The diagram has been given, so you can see that the patient has undergone gangrene, right? Okay, so first let's see the key words in it. So first, what you administer, it is intravenous thiopentone sodium. So what is thiopentone sodium? It is an intravenous, not inhalational. Many a times we forget that, right? It is an intravenous anesthetic agent. Next, patient complains of severe pain, okay, severe pain in his fingers. The fingers has become cyanosed, okay, and the diagram has been given. Okay, so just a second. Okay, so let's discuss what is to be done. Okay, so first, okay, thiopentone sodium, it is an intravenous induction agent. We can preferably say it is an induction agent. Okay, it is an IV, intravenous induction agent, right? And next, and what is the next thing? Okay, common confusion what we get, okay, whether it is a barbiturate or benzodiazepine, okay. So this is a common doubt we have. Always remember that thiopentone sodium is a barbiturate and not a benzodiazepine. Please remember that. Okay, please don't make a mistake in it. Barbiturate. Okay, thiopentone sodium is a barbiturate and it is not a benzodiazepine. Right? Okay. And next thing is, there is many points to discuss in it. It mainly is the action is terminated by rapid redistribution. Okay, the action is terminated. Okay, the action stops by, so this is a termination of action occurs by rapid redistribution. Okay, so that is one thing. Okay, so at this scenario, what is to be done? Okay, we can discuss a treatment protocol. That is the main thing of I want to discuss here, because it will be highly useful in a clinical scenario, and we would have at least faced one patient like that. If not, you might face, so be ready for it. Okay, so what has been given? Okay, let's see the diagram. See, I'll try to explain in this diagram itself. See, this is the picture given is a hand, okay, and these are the peripheries, and you can see that there is gangrene. Okay, see, there is gangrene all over. Okay, see, the patient has gangrene. So you know that we would have seen diabetic foot ulcer where there is gangrene, and there are many places where we can see gangrene. Okay, but here it occurs in the peripheries. So what has occurred exactly? See, let's take this as a diagram. Please forgive me for the diagram, it's not so good. Okay, ouch. Okay, so usually we administer thiopentone sodium. Okay, this is a brachial crease. Okay, we administer thiopentone sodium in a good IV line. Okay, thiopentone sodium is given in a good IV line, right? Good IV line in the sense in a good vein. Okay, in a good vein. So vein has a large lumen, right? Vein has a large lumen, and thiopentone sodium has a ability to form crystals. Okay, it usually forms crystals. Okay, so what would have occurred in this patient, which about whom we are discussing, is this patient, as we see here, see, this is the brachial crease. If a patient has been administered a good IV line, mostly this condition would not occur. So as the image is given as hand, mostly this patient would have got the injection at the brachial site, right? In this brachial site, see, there is veins. As you know, there is veins all over. There is brachial vein. But if you see, the arteries which usually will be in the deep, at the deep side, okay, it will be very deep. As nerves, no, these arteries will also be not so superficial. It will be very deep at other sides, but at this brachial site, it will be a little superficial, right? It will be a little superficial. You can even palpate the brachial artery, right? You can feel the brachial pulsations. So it will be a little superficial at this brachial crease, okay? So if, for example, a newly joined intern or anyone, if they try to inject into the brachial vein, instead of injecting into the brachial vein, if suppose, see, let's consider this as a brachial vein. Suppose if they don't inject in the brachial vein, and by mistake if they have injected into the brachial artery, that is the main reason for this condition. If they have instead of injecting into the brachial vein, if they have accidentally entered the brachial artery, then only we can face this situation. Okay, so why? Because see, this hand is a limb, it's a periphery. Okay, it is a periphery. See, the blood circulation in the hand it's a periphery, it's end organ, right? Okay, these are not end arteries. Remember, these are not end arteries. I didn't say end arteries, but like end organs, they have collateral circulation, right? See, at this wrist, they have collateral circulations, but at here, they form arterioles and capillaries. Okay, arterioles and capillaries. At the peripheries, it's like end organs, like end arteries. So they form arterioles. There are arterioles and capillary network. Everyone knows that in the hands we have collateral circulation. So what will actually happen is, see, this thiopentane sodium is able to form crystals, right? As I said, they can form crystals, right? They will form crystals. Okay, when these crystals, I've drawn a little bit big crystals, but okay, see, when these crystals, they enter, okay, when they enter this circulation, what will happen? The blood flow will become stopped. Okay, the blood flow is blocked. Okay, when these crystals they enter here, okay, the blood flow becomes blocked, right? Okay, so what will this cause? It will cause gangrene. Right? Though there is superior collateral circulation and many things, at this site when these crystals block, it forms gangrene. Okay, when it is injected into the vein, it directly goes to the heart, right? It goes to the heart, it gets purified. Okay, the lumen of the vein is larger, so there is no block. But when it is injected into the arteries, it directly reaches the peripheries, and that leads to gangrene. So what is the main cause? Accidental intra-arterial injection of TPS, that's thiopentane sodium, causes this. That we should remember. Okay, so we know that this causes crystal formation and thrombosis, right? Crystal formation, and it causes thrombosis, thereby leading to, what is that? It causes gangrene. So just imagine the situation of the patient. He just is admitted in the ward, and he has to undergo surgery. At the time they are injecting, and suddenly he sees his hand becoming necrosed. then how will the patient be, right? See, if just imagine if we face this situation, how bad it will be. So imagine how the patient would have been suffering. So what is the treatment? That is the main thing, no? So let's discuss the treatment. What is to be done? Okay, so let's discuss what is the treatment. If you know this treatment, we can probably save the hand of the patient, right? Okay, so what is the treatment? So step one, let's follow the same order. Try to follow the same order, guys. See, first note that the needle should not be removed. The needle should not be removed. So in that situation, in emergency, what is that situation? Emergency ward. What we'll be doing is commonly we will panic and we will remove the needle. If we remove the needle, then it will be a very worse situation for the patient. Remember that. Okay, so the needle should not be removed. Next, what? Administer heparin or administer saline. This is a common question everyone will have. Okay, whether to administer heparin or administer saline. So what we have to do is first administer a normal saline. First administer saline. Push the crystals. Okay, just dilute that. Dilute blood. Okay, dilute the drug, so that what happens is there is free mobility. So first administer saline. Next, third thing is administer heparin to prevent further thrombosis. Okay, third step is the step of administering heparin. Next, fourth, what we have to do is administer papaverine and lidocaine. Administer papaverine and lidocaine. Probably after injecting heparin itself, most of the limb we can save it. Okay, that is the main thing. We can at least prevent further vasospasm and gangrene. But next, you have to administer papaverine and lidocaine. Okay, to prevent the pain reaction and to make that numb. Next is to prevent any sympathetic or parasympathetic stimulation. What you have to do is you have to give a brachial plexus block. Brachial plexus block, provided it is in the hand. Okay, if there is an intraarterial injection of thiopurine sodium at the brachial site, you are going to give brachial plexus block. If it is in the limb, might be will give popliteal block and next to that, like that. Okay, if that it is given in the ankle, we might give an ankle block. If it is in a particular like a finger, then we might be, but most of the we cannot say it at finger and all, because it will be not so specific. No one will inject at that particular site, not fingers or things. But I have also seen patients who are having who had their IV line at the finger veins also. So that is also possible. But I am saying in generally brachial plexus block for hands. Okay, so mostly this situation occurs at the brachial side, right? So or give a stellate ganglion block. Or give a stellate ganglion block. Okay, why is this block given? To relieve vasospasm. To relieve vasospasm. Okay, the crystals have caused immense vasospasm. So to relieve it, this brachial plexus block is given. So these are the steps. Just by heart it. Okay, just by heart. Just understand it and by heart. Just put yourself in that situation. See, when a patient comes, what would we do at that time, right? See, when a patient comes with suddenly he comes with necrosis, what would we doing? Probably it will not occur in an emergency center. It will probably occur in the OT, operation theatre, right? Because there only they give the induction agent, right? So see, what we have to do is the needle should not be removed. Remember that. And next is administer saline, right? Maybe I choose another color so that it is quite visible, right? So first, needle should not be removed. Next is administer saline. Next is administer heparin. Next, give papaverine and lidocaine. And next, last is give the nerve block. Give brachial plexus block or give a stellate ganglion block. Why is it given? To relieve vasospasm. Okay, if we do this, probably we are saving the limb of the patient. Okay, if you are giving this, probably we will be saving the limb of the patient. Okay, so we might save the limb of the patient. Everyone is thinking what he's saying, saying the limb of the patient and what is it, erasing his fingers. No, if we give like that, probably we can save the limb of the patient. And preferably try it always to avoid giving injection at this site, that is at the brachial plexus site. Okay, just one second. See, the limb of the patient has been gone. Okay, we will draw it. Okay, so we can probably save the limb of the patient. So this is a important clinical scenario which I found it very useful, and I wanted to share it with you guys. So see, what is the treatment? Just remember the treatment. Just forget about all these. Just remember this page. Okay, so what you have to give the treatment. Okay, see, so needle should not be removed. Next, administer saline, administer heparin, papaverine and lidocaine, brachial plexus block or stellate ganglion block. So these are the things we have to probably do. Okay, so that's what we have to do. So just don't forget this. It's an important clinical scenario which should be highly useful. Highly useful. I repeat, highly useful. It will really be useful for you guys. Okay, so that's all for today. Have a good day, guys. I'm sorry, just a second. I just write this. Have a good day, guys. Take care, and please listen this video at least at 1.5 or 2x. Okay, so thank you.